Alright, this is PART 365. Myself Srija. So today we are going to learn about the ICD-10 coding classification for the diseases of the nervous system. So in this you are going to learn about the introduction to ICD-10 codes, so related to the nervous system, and what are the guidelines, and also how the diseases were classified. Yeah. So what is nervous system? So nervous system, it's a control center of the body, right? So it manages everything you do, including thinking, feeling, movement, breathing, heartbeat, and all vital activities. So it has two main parts, this central nervous system and the peripheral nervous system, right? So what are included in the central nervous system? The brain and spinal cord. And in peripheral nervous system, all cranial nerves and also all the spinal nerves. So these nerves, they carry the messages between the CNS and the rest of the body. So what can go wrong with the nervous system? So what does the G00 to G99 codes covers? So the code range covers the diseases that can affect any part of the system. The brain and spinal cord, CNS diseases like meningitis, seizures, and also the multiple sclerosis. The nerves and nerve roots, the peripheral nervous system, for example, neuropathy and radiculopathy. Coming to neuromuscular junction disorders, so where nerves meet muscles, for example, myasthenia gravis. So muscles under nervous control, for example, muscular dystrophies. So why do we use ICD-10 codes? So ICD-10 codes, they helps to identify the diseases. So they helps to classify the diseases. They also help to standardize the diagnosis coding. So they ensure accurate billing and also the reporting. So chapter 6 of ICD-10 codes, G00 to G99, this includes all the diseases of the nervous system, arranged from 000, that is infections, up to G99 for other neurological conditions. So they cover through various nervous system disorders. So coming to the classification of the G series codes. So what is the purpose of this chapter? What is the purpose? So to classify, to code all the medical conditions that affect the structure or function of the nervous system, such as brain, spinal cord, nerves, neuromuscular junctions, and also muscles controlled by nerves. So any disease related to nervous system is coded in G00 to G99 series. So what type of diseases are included over here? This chapter covers a large variety of conditions including inflammatory, degenerative, vascular, demyelinating, hereditary, traumatic, and there are major subdivisions of the nervous system codes. So this part of the chapter, it gives a structured breakdown of the first few code groups. For example, G00 to G09, what it is? It's an inflammatory disease of the CNS. So these codes, they include conditions where the brain or spinal cord are inflamed. For example, we take meningitis, right? So next, G10 to G14, it's a systematic atrophies primarily affecting central nervous system. So these are the degenerative or hereditary conditions that causes the progressive loss of brain and spinal cord tissue. For example, Huntington's disease, you have to code G10. So next, coming to G20 to G26, it's extrapyramidal and movement disorders. So these affect the movement, muscle control, and coordination, which is often due to the damage in the basal ganglia. For example, Parkinson's disease, we used to code the G20 code. So G30 to G32, it is other degenerative diseases of the nervous system. So these are the disorders where the nervous system gradually worsens over time. For example, when we take Alzheimer's disease, we assign the code G30. So in simple, it is a chapter for all the nervous system diseases. So these codes are grouped logically based on the type of disease and which part of the nervous system is affected. So coming to G35 to G37, it's a demyelinating disease of the CNS. So what does it mean? These are the conditions where the myelin sheath, you know about the myelin sheath, right? It is the protective covering of the nerves in the brain and the spinal cord. So these are the conditions where the myelinating sheath gets damaged. When it's damaged, you have to code these code ranges. So when coming to G40 to G47, it's a episodic and paroxysmal disorders. So these disorders occur in these sudden episodes. For example, like migraine, like sleep disorders. So G50 to G59, it includes nerve root and plexus disorders. Nothing but these involve the problems with peripheral nerves, nerve roots and also plexuses. For example, carpal tunnel syndrome, we assign the code G56. So next G60 to G65, it is polyneuropathies and other peripheral nervous system disorders. So these affect the multiple nerves throughout the body. For example, hereditary neuropathy and alcoholic polyneuropathy. So G70 to G73, it is a disorders of myoneural junction and muscle. So what does this involve? They involve the problems where nerves communicate with the muscles or issues in the muscle themselves. For example, when you take myasthenia gravis, you assign the code G70. So G80 to G83, it's a cerebral palsy and other paralytic syndromes. So these are the disorders causing movement and also the posture problems. For example, cerebral palsy, we assign the code G80. So the last code range G89 to G99. So this includes the miscellaneous neurological conditions which are not covered elsewhere. For example, chronic pain syndrome, it is G89. So let's discuss about the deep classification of the diseases. So when coming to G00 to G09, so what does this category include? So this ICD-10-CM category includes diseases where the brain, spinal cord or meninges, they become inflamed, right? Inflammation means it's a infection. So how does this inflammation done? So this can be caused by the bacteria, viruses, fungi, parasites and also the autoimmune reactions. So these conditions are serious, so they can be often life threatening and also they need the urgent treatment. So what does this category covers? So infections and inflammation of the brain, spinal cord and also the meninges like meningitis. So what are the common conditions in G00 to G09? Meningitis, right? So what do you mean by meningitis? Meninge means meninges. So itis means inflammation. So meningitis is nothing but the inflammation or the infection of the meninges. So what are the symptoms of meninges or meningitis? It's a severe headache, a fever, neck stiffness, and also the light sensitivity. So how it is caused? It may be caused due to a bacteria, maybe a virus, or a fungal, or a parasitic. This is meningitis. And coming to encephalitis. Encephalitis means inflammation of the brain tissue. So what will be the symptoms of this encephalitis? It may be a confusion, seizures, behavioral changes, and also coma in severe cases. So what will be the common causes of encephalitis? Viral infections, for example, herpes virus. So coming to myelitis. Myelitis nothing but it's an inflammation of the spinal cord. The word means a spinal cord. So what will be the symptoms of myelitis? Maybe a weakness, paralysis, and also a sensory loss and a bowel and bladder problems. So you can often see in these conditions like transverse myelitis. So next coming to brain or spinal abscess, you assign the code as G06. So what is a brain or spinal abscess? A collection of pus inside the central nervous system. So how do this pus is collected? Due to infection. So whenever infection is caused, you can see the collection of pus, right? Yeah, a collection of pus inside the central nervous system due to infection are coded under the brain or spinal abscess. So you assign the code G06. So what will be the symptoms of this? Maybe a severe headache, a fever, and also the neurological deficits like weakness, seizures, etc. So this is a medical emergency. So why these codes are important? Because they helps in proper clarification, okay, and also the documentation of the serious CNS infections. So these codes, they ensures correct treatment, monitoring, and also the reporting. So they support the medical research and also the public health planning. Now coming into the classification, G00 to G09. So what is G00? It's a bacterial meningitis. So what do you mean by it? This code is used when the meningitis, the inflammation of the meninges, it is caused by the bacteria. For example, when you take G00 to 0 subcode, it is Haemophilus meningitis. So what is Haemophilus here? It's a bacteria. Haemophilus influenza is a bacteria. So this bacteria causes the Haemophilus meningitis. So for example, when a child with fever and neck stiffness and also the CSF test, he is positive for H influenza. This is the example for the G00.0 code. So other subcodes like G00.1 and G00.2 etc. they identify the other specific bacteria. So each and every category has a specific bacteria. So coming to G01, it's a meningitis in bacterial disease elsewhere classified. So what do you mean? It is used whenever the meningitis is due to another bacterial disease that has its own code. For example, when you take this tubercular meningitis, you have to code G01 first. Then you have to add the tuberculosis code from A category series, because here the tuberculosis is the main disease, right? This tuberculosis is the primary. This has to be listed the first code because it is causing the meningitis. Now meningitis is an add-on code. It's a secondary diagnosis. You got my point, right? Yeah, and next coming to G02. It is meningitis in other infectious disease. So it's nothing but the meningitis, it is caused by the infections other than the bacteria. Z00 and Z01 is about the bacteria. Coming to Z02, it is other than the bacteria. For example, syphilis causing the meningitis, HIV related meningitis. So you have to code the Z02 plus the code for the underlying disease. So next coming to G03, it is meningitis due to an unspecified cause. That means when the cause of meningitis is not known, you have to assign the code G03. For example, G03.9, meningitis unspecified. So this is used when the CSF shows the inflammation but no organism is detected. So here you can see a picture of meningitis and as well as the encephalitis. So what are you seeing is meningitis? You can see the difference between the normal one and the infected one, right? The normal one, it is a very normal, right? You can see the meninges as normal, but in the infected one, you can see the bacterial invasion, the bacterial infection. It is causing the swelling and inflammation, right? So when coming to encephalitis, the inflammation of the brain tissue, you can see the inflammation of the brain tissue. How it is infected? Through bacteria called herpes virus, and this is the herpes bacteria. It is causing the inflammation of the brain, leading to encephalitis, right? So this helps you to how to understand the inflammation differences between the meningitis and also the brain. So this is about the meningitis and encephalitis. So next coming to Z04 to Z09 series, nothing but these are also the inflammatory diseases of the CNS. So what is Z04? It's a encephalitis, myelitis and also encephalomyelitis. So what do you mean? What do you mean by encephalitis? It's an inflammation of the brain. Myelitis, inflammation of the spinal cord. Whereas encephalomyelitis, it's an inflammation of both brain and spinal cord. So coming to G04.0, it's an acute disseminated encephalitis. So what do you mean by it? You can also call it as ADEM in short form, right? So it is nothing but it's a rapidly developing inflammation of the brain and also the spinal cord. So it often follows viral infections or the vaccines. So this causes the confusion, seizures and also the weakness. So whenever a patient is diagnosed with encephalitis, myelitis and also the encephalomyelitis, you can assign the code G04. So coming to Z05, it is encephalitis, meningitis in diseases classified elsewhere. So this is used when encephalitis or meningitis happens as part of the another disease. So this is due to measles infection. You have to code Z05 as the primary and then you have to add the measles code B05 as an additional one. Because measles is the main condition causing the encephalitis, right? This measles is the underlying disease. So it causes the inflammation. So next, Z06, what it is? It's an intracranial and intraspinal abscess. So these codes cover the pus-filled infections inside the brain and the spinal cord. For example, extradural and subdural abscess, nothing but these abscesses occur outside the brain. Extradural means outside the brain. Subdural means inside the brain, right? So this cover the abscesses whenever the pus-filled infection is caused outside the brain and inside the skull. So G06 codes can be assigned. For example, when the brain abscess is caused by ear infection, just you have to code G06.0. So whenever it is extradural and subdural, you have to code G06.2. So next, G07. So it's an intracranial and intraspinal abscess in disease classified elsewhere. So what do you mean by it? It is used when brain abscess, when the pus-filled infection, it happens due to another infection. But that another infection, it has an own code already. So what you have to, how do you code in such cases? You have to give G07 code as well as the underlying disease codes. So whatever a specific category is given for the underlying disease, you have to code the other code also. You have to give two codes. So coming to G08, it's an intracranial and intraspinal phlebitis and thrombophlebitis. So what do you mean by it? Inflammation of veins in the brain or spinal cord is nothing but intraspinal phlebitis or thrombophlebitis. So blood clots forming inside these veins. So septic thrombosis of cavernous sinus. This is an example. Nothing but it's a serious clot caused by the infection. And next G09, what does it tell? It is used when the patient has a long-term complications after meningitis, after encephalitis or the brain abscess. For example, the long-term epilepsy after meningitis, you have to assign the code G09. It's a sequela code. Yeah, here is a picture. You can see clearly the differences between phlebitis and thrombophlebitis. So what is the difference actually? So what do you mean by phlebitis? It's a inflammation of vein, right? Phlebo means vein. Itis means inflammation. It's an inflammation of vein. So in this picture, you can see the red areas, right? Along the superficial veins of the leg. So this happens when the vein wall becomes irritated. So this causes the pain, redness, warmth and swelling. So there is no blood clot yet. There is only the inflammation. So coming to thrombophlebitis. So what do you mean by thrombophlebitis? Thrombus means blood clot plus inflammation. So this means the vein is inflamed and also a blood clot has formed inside the vein. So the major difference is just a formation of the blood clot is different from phlebitis and thrombophlebitis. So what the diagram shows over here, the healthy vein has a smooth blood flow, whereas in thrombosis, a clot blocks the blood flow. So blood starts pooling behind the clot. So what does it causes? It causes a pain, swelling and redness. So a warm tender area over the vein. So the label picture shows the valve in the vein. You can see a valve in the vein, the blood clot blocking the blood flow, the pooling blood behind the clot and also the pain and swelling around the inflamed area, right? Yeah, this is the main difference between the phlebitis and thrombophlebitis. So you have learnt about these in this video. So in the next session, you are going to learn some more classification of the ICD-10-CM for diseases of the nervous system. So thank you. Have a good day.